It is expected that the now 7-month-long battle to eradicate COVID-19 would result in hundreds of frontline workers being burned out and overwhelmed by the sharp rise in cases and deaths as a result of the disease. But that's not the case for 27-year-old Marian George, a medical technologist at the Georgetown Public Hospital. Hailing from the small Amerindian village of Camarang in Upper Mazaruni Region 7, George, who grew up with her parents, was awarded the Ministry of Amerindian Affairs scholarship in 2004, where she was able to attend Christchurch Secondary School. Thereafter, she attended the University of Guyana, where she was able to attain a bachelor's degree in medical technology in 2015 and has been working as a medical technologist since. In a sit-down with HEP Nightly News on Wednesday, George expressed that the pandemic has redefined working in the medical field. Like many other healthcare workers, she related some of her experiences to date participating in efforts to combat this global major health challenge.
The workload is much more now because of the rise in the numbers and the amount of patients you would have hospitalized, and we would have to run these patient samples, whatever the doctor has requested, that would help in their care.
She narrated that before the pandemic, she worked 8 hours daily, but for the past couple of months, she has been working 12-hour shifts. The medical technologist, however, posited that she does not feel pressured since she is cognizant of what it will take to make this dreaded disease disappear. George was among 30 technicians who were recently trained in polymerized chain reaction testing, which was offered by the Ministry of Health.
And the training brought to light many things that you don't know about the virus as yet, how it's transmitted, the DNA, how it's made up, and all these really fine details about the virus. We were able to learn about that in our training.
Acknowledging the fear that she feels in handling blood samples on a daily basis as she puts her life at risk, she pleaded with Guyanese to adhere to the precautionary health measures in place.
We need to all be each other's keeper, and even though we're not all related, we're not all close friends, we still need to see each other as human beings, and we need to protect ourselves and those around us. So they really need to follow the guidelines that are placed.
As the nation observes Amerindian Heritage Month, Marian's hope for other Indigenous persons is that they recognize that they can do and be anything they aspire to.
You just have to believe in yourself and know that you can do anything that you set your mind to. It doesn't matter who you are or where you came from, once you put your mind to it.
For the HEP Nightly News, Kendell Richmond.